So today we're going to be talking about the morning glory disc and the reason it's important in neuro-op. I was asked to do this actually today by one of the mothers of one of my patients. And she's following us on YouTube, so hello. So the flower, morning glory, has a central white tuft. Radiating out to the petals are these little radiating lines, and you can go Google on the internet what a morning glory looks like. The flower looks like the cavitary disc anomaly, which we call morning glory disc. It also is a big disc with peripapillary atrophy, just like the flower. In the center is a central white glial tuft. It is on the spectrum of cavitary disc anomalies, similar to coloboma, but I think it's slightly different. The vessels radiate out from the edge of the disc. So the combination of the peripapillary retinal pigment epithelial derangement, the big disc, the glial white tuft, and the radiating vessels out from the edge of the disc margin all suggest that this is a morning glory disc. The reason it's important is there are both ocular complications that occur with the morning glory disc and the intracranial central nervous system anomalies. From the ocular standpoint, patients often have amblyopia, and that amblyopia is often multifactorial. It can be deprivation just from having the vision loss. Sometimes they have associated cataract or other anterior segment abnormalities, including iris abnormalities and heterochromia. It can cause strabismus, for which the patient might have to have strabismus surgery, which is a secondary cause of strabismic amblyopia, and they're going to have anisometropia. The prescription between the two eyes is not going to be the same. Metropia, eye same, not. So they often have amblyopia in the affected morning gloria. The central nervous system associations, however, are of importance to neuro-op. And that means we're going to be looking at skull base abnormalities, as well as central midline abnormalities involving the hypothalamic pituitary axis and the presence of the moya moya. So moya moya in Japanese means puff of smoke. It is associated with intracranial stenosis of the branches of the internal carotid artery. And so we can have multifocal areas of stenosis in the brain. And the characteristic angiographic finding is moya moya. So they get the stenosis here, stenotic segment here. So for example, the MCA, this segment is stenotic. And then there's all these collaterals forming that on the angiogram look like a puff of smoke. And so the treatments are to either bypass this MCA stenotic segment. For example, we can use the external carotid artery, a superficial temporal artery to MCA bypass, to bypass this stenotic segment. And normally we would only do that if you had ischemia, ischemic events, stroke, or hemorrhage. But you need to do an imaging study in patients who have the morning glory syndrome. That's normally MRI plus MRA to look for both the central nervous system abnormalities in the midline and the skull base, but also for this very strange thing, moya moya disease, an intracranial, non-inflammatory, non-atherogenic stenosis of the major intracranial arteries, for which we might have to do a bypass or other neurovascular neurosurgical procedure. And go look up what a morning glory flower looks like. It looks pretty much like the morning glory cavitary disc anomaly. And don't forget to image it and also treat the amblyopia.